Hello, this is Dr. Weaver, and today we're going to review parasitology in preparation for taking the VTNE. I just want to start by saying that parasitology is a huge topic. There are so many parasites with so many individual nuances to each of them. We're going to just kind of touch on some of the highlights or common parasites that you need to be well versed in for the VTNE. And so on the VTNE, you're going to see parasites in the laboratory procedures domain. We might see parasites in the animal care and nursing domain and potentially in pharmacology as well. I really recommend you create handwritten flashcards. And on one side, you're going to write the parasite name. And then on the back, you're going to draw a picture of the parasite and maybe just put a few pieces of key information about that parasite. Handwriting is a really valuable way for you to remember information, and it lends itself really well to parasites. Our test tip of the week is to consider all the answer choices before making a selection. Even if you recognize the answer, don't rush to mark it until you've checked all of the answer choices. If you can identify that at least 2 of the answer choices are correct, then you also want to be looking for something that says all of the above. If you jumped and answered without reviewing all the choices, you might miss this question. Okay, today we're going to cover nematodes, cestodes, trematodes, protozoa, and ectoparasites. Grouping parasites by their phylum is a great tool to remember all these parasites. For example, most nematodes are diagnosed on a fecal float, and most cestodes are treated with praziquantel. So it really helps to think about these parasites in their phylum, and we can draw conclusions or make good guesses if we can't remember every specific detail about a given parasite. The first group we're going to talk about is really the biggest group of parasites and maybe the group that has the most emphasis on it, so the nematodes. Nematodes are commonly called roundworms because they have a cylindrical body shape. So in other words, these worms tend to look like spaghetti. They're kind of our long, skinny spaghetti worms. Most roundworms have a similar life cycle that starts with an egg. The egg embryonates and then little larvae hatch out. The larvae grow and molt and gradually turn into adults. We tend to have a male and female adult that sexually reproduce, and the cycle starts again. Some nematodes have a direct life cycle in which they do not require another intermediate host to complete their life cycle. And then an indirect life cycle means they need to have some other critter involved in their life cycle to complete their stage. Transmission of nematodes is often through eating the parasite itself or eating the intermediate host, but some of them can penetrate skin or be deposited into the skin or in the intermediate host. And then within nematodes, we have 11 different superfamilies that are all kind of significant in veterinary medicine. Because this is just a brief overview of parasitology, today I'm going to go through 9 of those superfamilies. And I'll name those. But organizing our parasites by groups really helps us to think about their life cycle, their diagnosis, and their treatment. It really helps to break material into chunks when we're trying to memorize large amounts of information. So the first superfamily within nematodes are the Ascarids. And these are the ones that are commonly called roundworms. There's different Ascarids for different species, but if you see the root word Ascaris or Ascarid, then you have a roundworm. Our first Ascarids are the Toxocara canis, cati, and leonina. These are the roundworms of dogs and cats, and the clinical signs are mostly GI, so vomiting, diarrhea. When you see a little puppy or kitten that has a big distended belly and kind of looks sickly, and we say, oh, they look wormy, we're talking about this type of roundworm. We think that it is filling those little puppy and kitten bellies. In addition to infecting our dogs and cats, it does have a zoonotic potential. So it can cause visceral larval migrans, which means that in the human, the larvae migrate around your viscera. Your viscera are your internal organs. So the larva can migrate between your liver and your lungs and your spleen and your kidneys and your intestines and just go swimming around in your abdomen. In addition, these can cause ocular larval migrans in humans, which means that they can migrate around the inside of your eye. The diagnosis of these roundworms is through fecal float. The ova are pretty light or less dense than the fecusol solution, and so they float, whereas the other material in poop sinks to the bottom. And those eggs tend to have a rough outer layer when we're talking about the dog, Toxocara canis, whereas the cat, Toxocara cati or leonina, have more of a smooth outer shell. But both of them have this hyaline ground glass central appearance to the egg, so they're pretty recognizable when you see them. Treatment is going to be pyrantel or fenbendazole, and I don't have it on here, but macrocytic lactones also have effects against our Toxocara canis, cati, and leonina. The next Ascarid is Parascaris equorum. And so if you look at the name there and you see the Ascaris, that tells you we're talking about a type of nematode. The equorum sort of sounds like equine. And so I think if you encountered this word on your VTNE, you could figure out that we're talking about the equine roundworm. This mostly affects the small intestines. It's most abundant in foals. And the parasitic life cycle involves tracheal migration of the larva. We can diagnose these ova or eggs on fecal float, just like the dog and cat roundworms. And again, the roundworm here has a little bit of a rough outer layer, and then that ground glass hyaline appearance to the inside of the egg. So similar looking egg as the Toxocara canis and cati. The next Ascarid we're going to cover is Ascaris suum. And so again, there's that word Ascaris, which clues you in that we're dealing with a roundworm. This is the swine roundworm, or the roundworm of a pig. And it's found within the small intestine of the pig, and we can diagnose the eggs on fecal flotation. To me, the eggs look similar to the other roundworms we've talked about, but maybe they're a little bit more oval shaped and not as perfectly round. But again, they have a rough outer layer and then a ground glass or hyaline appearing center. The next superfamily of the nematodes is called Strongyloideae. This superfamily includes hookworms and also the large strongyles of horses. So there's a lot of different types of hookworms. Many of them have the name Ancylostoma or Uncinaria, and then they have a species after it. You need to remember that hookworms can produce severe anemia in puppies and kittens, and they are zoonotic and can cause cutaneous larval migrans. I have a picture of the cutaneous larval migrans in the upper right corner. So if there is a poop sample that sits in the yard until the larva is at the infective stage, and then someone goes walking through the yard barefoot, the larva can migrate through the skin and cause this condition, cutaneous larval migrans. Let's look at the life cycle. The infective stage is L3, so that's the third size of the larva, or the third stage larva. This larva is swallowed, or it can penetrate skin, and then it migrates to the lungs, and then the dog or cat coughs it up and swallows it again. The larva matures in the gastrointestinal tract, and it attaches to a capillary bed, which is why it causes some bleeding and anemia. It's kind of like it gets its little hooks in there and causes bleeding. Male and female worms mate, and the eggs are passed in the feces. And then while sitting in the environment, the eggs mature from the L1 larva into the L2 and L3, keeping in mind that the L3 is the infective stage. Eggs in this superfamily often have a thin wall, and you can see a morula or a clump of cells inside of it. So this picture shows a thin-walled Ancylostoma egg with a morula or clump of cells inside. And we're going to diagnose that on fecal float because we are a nematode, and nematode ova or eggs frequently float. All right, let's talk about strongyles. Strongyles are nematodes that parasitize the large intestines of horses, and we have two types, large strongyles and small strongyles. The large strongyles are the ones that are in this superfamily we're talking about, the Strongyloideae, and they're the most pathogenic. They cause the most problems. Regardless of whether they are large or small, the eggs are identical. So we can't really tell the difference in the parasite based on the eggs. We can just say we have a strongyle-like ova rather than a particular species of strongyles. If we wanted to identify the specific species, we would need to do a fecal culture, and that would help us differentiate large and small strongyles. So, Strongylus vulgaris is our large strongyle, and this affects the horse. And the parasite eventually causes problems by filling up the mesenteric arteries. It's in the blood vessels, so the blood flow is disrupted to the intestinal tract because the parasite is in the blood vessels itself. And so this parasite is called the blood worm because it's not inside the intestines, it's in the blood vessels that feed the intestines, and so the blood supply is cut off. What results is that the horse has acute peritonitis or colic. They all of a sudden have poor blood flow to their GI tract, and so they're going to colic. Diagnosis is a bit more tricky because we're looking for a worm that's in a blood vessel. Sometimes we can find these eggs in the fecal float due to their life cycle being a little bit more complex. And sometimes we can do a coproculture or a culture of the feces to determine if it's present. And then sometimes we're going to find it through exploratory laparotomy. If we are performing surgery for colic, we may find that the mesenteric arteries are full of worms. So treatment is typically surgery, but we really want to prevent this with routine deworming. And when we talk about large animals, we'll talk about horse deworming protocols, which are frequent based on the region, to just deworm horses multiple times throughout the year so that we don't get these parasites. The next superfamily is called Trichostrongyloideae, and these are going to affect ruminants and different parts of their GI tract. So they could infect the abomasum, the small or the large intestines of our ruminants. There's quite a few genera that can produce eggs in this superfamily. The one we're going to talk about is the homuncus. But take a look at these other genera so you're familiar with different types of Trichostrongyloideae nematodes that affect ruminants. Homuncus contortus is called the Barber pole worm of sheep, and it's named the Barber's pole worm because of the appearance of the worm itself. So if you look at this picture here, you can see that the worm has a stripy appearance to it, like a barber's pole outside a barber shop. And so, as I mentioned, this infects sheep and it causes anemia when they're infected. As a result, the sheep become edematous and they start to have edema build up underneath their jaw, which is called a bottle jaw. They experience weight loss and then they can die from this parasite as well. And it's going to be diagnosed via fecal float. The next nematode superfamily is Rhabditoideae. These are called intestinal threadworms, and I have 3 of them listed here. So we have Strongyloides stercoralis, which affects dogs and humans, Strongyloides westeri, which affects horses, and Strongyloides ransomii, which affects pigs. All right, so there's 2 things that are interesting about these. Only a parthenogenic female is parasitic in the host, and you're probably wondering what that word means. Parthenogenic is a condition in which the females produce their eggs that develop without fertilization. So no male is required. The eggs can complete the life cycle without fertilization from a male. And then the other interesting thing in dogs, the Strongyloides stercoralis eggs, they hatch in the intestine and they're released as a first stage larva. So remember, for most of our nematodes, the eggs are released in the feces. But in this particular parasite, the eggs hatch inside the intestine. And so by the time they're released in the feces, they are already a first stage larva. And so that's a little unique for a nematode. The next nematode superfamily are the Metastrongyloideae, and these are lungworms. I've listed 4 of them here. We have Mullaris capillaris of sheep and goat, Metastrongylus apri of swine, Philoroides of dogs, and Aleurostrongylus abstrusis of cats. And so I want to back up for a minute and remind you about the nematode life cycle. So I showed this at the beginning of this section, and remember, eggs embryonate and then they hatch into larvae, which usually go through about 4 developmental stages where they're growing and eventually turn into sexually mature adults. The L3 larva is typically the infective stage at which the next animal can become infected with the parasite. And that's the case for a lot of nematodes, especially the nematodes that have a direct life cycle. L3 is most commonly the infective stage. But the Philoroides are unique because their first stage larvae are immediately effective. And what this means is there's no real period of development that's required outside of the host. So for a lot of the other nematodes, the animal will poop out the eggs embryonate and hatch into larvae in the yard. And so there's a time period between when the animal poops and when the larva is infective. But that's not the case for Philoroides. They're infective really, really soon after being deposited in the environment. The other thing that's kind of interesting about our Metastrongyloideae are that these are the parasites that we're frequently diagnosing using the Bayerman test. We can find the eggs on fecal float, but because they're turning into that first stage larva so quickly, we're going to be looking for the larva. And the Bayerman test is a good test for nematode larvae, but specifically for this lungworm larva. So we should always be kind of associating our Metastrongyloideae with our Bayerman test. And if you've forgotten what that test is all about, that's the test where we will put some feces on top of a funnel, usually on a metal screen or in some cheesecloth. And then we're going to run warm water through the sample. And the larvae are stimulated to move through the warm water and they sink to the bottom of the apparatus. And so we can look at some of the material that comes out of the bottom to look for the presence of larvae. Relatively free of debris. A lot of the debris stays higher or even within the screen or cheesecloth. The next nematode superfamily are the Trichiuridae, and these include Trichuris vulpis, which is the canine whipworm, Trichuris ovis, which is the bovine whipworm, Trichuris campanula and serrata, which are the feline whipworms, and then Trichinella spiralis, which is the porkworm. We're going to talk about Trichuris vulpis and Trichinella. All right, Trichuris vulpis, we call this the whipworm. This parasite is found in the large intestines, so in the cecum and colon of dogs, and it causes GI signs related to diarrhea and weight loss. We could see some blood in the feces. It's rarely zoonotic, so this isn't a huge risk for people. We're going to diagnose the eggs on fecal float. And I just wanted to talk about how they get their name. So take a look at the picture in the lower right corner. Whipworms have a thin filamentous cranial end, so that's the front of the worm, that we consider the lash of the whip. And then the thick caudal end is like the handle of a whip. And so that appearance is why we've called them whipworms. They look like a little whip. The egg is also really distinct because it has the polar plugs at both ends, so this is easily recognizable. Trichinella spiralis is the porkworm, and this parasite is found in the muscle meat of pigs. And if we don't fully cook the pork meat, we can get sick from Trichinella. So humans can become infected by eating raw pork, as could other mammals if they ate raw pork. It doesn't cause too much disease for the pig itself. It's more just the zoonotic potential. It can cause GI upset and vague symptoms for up to 8 weeks if people get infected. The next nematode superfamily is Oxyuridae, and the example I have for you is Oxyurus equi, which is the pinworm of horses. And just like a little VTNE trick, if you look at that word Oxyurus equi, you should be thinking about a horse because of the equi. It's related to equine. So that root word means horse. So for this pinworm, the adult worms are found in the cecum, colon, and rectum. And the adult female will attach the eggs to the anus, which makes the horse really itchy. That word pruritus means itchy. As the horse itches and scratches, they tend to cause damage to the hair and get a bit of a disheveled look around their tail base. So we can recognize that something's going on with the horse in the picture here. And then the thing to note is that carnivores don't get pinworms, and pinworms are really species specific. So if a child has pinworm, they got it from another child. They did not get it from an animal. The next nematode superfamily is Spiroideae, and this superfamily includes Habronema, Drachia, and Thalasia. Habronema species and Drachia, these are nematodes that are found in the stomachs of horses, and they can cause summer sores. Summer sores are a skin infection that are caused by the larvae of these Habronema or Drachia when a fly deposits the larva into an open wound. Common areas are around the eyes, mouth, maybe their sheath or genitals, or even their joints. And the larva can cause pretty severe inflammatory reactions and causes these characteristic lesions. Thalasia californiensis is the eye worm, and this parasite affects dogs, cats, deer, and humans. It's also spread by flies, and when an animal is infected, their eye is irritated, as you may imagine. So their clinical signs all relate to having worms in their eye. So conjunctivitis, epiphora, pruritus, maybe their corneas look cloudy or they could get corneal ulcers. Rarely it might cause blindness. And the diagnosis is just visualization. So if you can see those worms, the dog or cat is infected with Thalasia. Treatment is manual removal. We could also use something like an ivermectin, milbemycin, or moxidectin. Those drugs are all macrocytic lactones. The last superfamily that we're going to talk about today are the Filaroideae, and these, if you see that word, you should be thinking microfilaria. They kind of sound similar, but we have two parasites that we have to distinguish between. So the Dirofilaria immitis is the parasite that you know as heartworm, and we're going to distinguish that from Dipetalonema, which is another parasite that has microfilaria in a peripheral blood smear. And so we have to be aware that there's two parasites that can cause this. Dirofilaria immitis is commonly called heartworm infection, and this is typically found in dogs, cats, and ferrets. When animals are infected, they have respiratory symptoms because the parasite, the adult worms live in the right pulmonary arteries, and so they're blocking the blood flow between the heart and the lungs. And so our patients might have difficulty exercising. They might run and then stop and really have to rest in order to catch their breath. So they can't exercise the way they normally would. They could also have dyspnea just at rest, so increased respiratory effort or difficulty breathing. We could see cyanosis and collapse or even ascites when an animal is infected with Dirofilaria immitis. This parasite is diagnosed in several ways. We could perform an ELISA test. So sometimes we're calling these SNAP tests. The ELISA test for heartworm is looking for the antigen of the adult female worm. I think there are newer tests in the pipeline that will be less specific, but the existing or older tests were specific for the adult female antigen. We could also see microfilaria on a direct blood smear if a patient is heavily infected, and then we could use a modified NOTS, which is a special stain to try and see the microfilaria more easily. Treatment for heartworm disease is a set of injections of molarcimine. This is an arsenic derivative that's given into the apaxial muscles. And most easily is to prevent heartworm disease by putting a patient on a macrocytic lactone And I'm going to talk about the macrocytic lactones next. So nematodes can be treated with a variety of meds, but macrocytic lactones are a really important group. These drugs will attack the nervous system of the parasite, and they're geared towards nematodes, bots, lice, some mites, and grubs. They don't affect the mammalian nervous system in the same way. So they're usually pretty safe for our mammal patients, but they can be neurotoxic to the herding breeds that have an MDR1 mutation. And so you might have heard the phrase, white feet don't treat. And that's because some of these herding breeds carry MDR1 mutation and they don't metabolize their macrocytic lactones properly. Now, the very low doses that are found in a lot of our heartworm preventatives are supposed to be safe for our herding breeds, but it's just a little piece of trivia that we need to be aware of. Okay, examples of macrocytic lactones. The first one is ivermectin. This is the product that's present in Heartgard as well as other, heartworm preventatives on the market. I'm just putting an example up here. Selamectin is another macrocytic lactone. This is the main ingredient in Revolution. Moxidectin is found in ProHeart and Simparica Trio. Milbemycin is the macrocytic lactone found in Interceptor. And over time, these medications tend to change. Right now, we're seeing a lot of combination products that might involve a macrocytic lactone, an isoxazoline, maybe a dewormer. And so it's important that you understand what the individual drugs are in a combination product, and so what those are preventing or treating. Macrocytic lactones are great against nematodes. We can also treat nematodes with benzimidazoles. These are going to target reproduction in the parasites, so they inhibit mitosis and meiosis. Examples are fembendazole, which is Panacur, oxybendazole, which is the equine anthelcide, and albendazole, which is valbazin. Another class that is commonly used for nematodes are the tetrahydropyrimidines, and the drug in this family is Pyrantel. The brand names we see frequently are Nemex or Strongid, and Pyrantel is started in puppies at different ages based on the region and the protocol, but potentially as early as 2 weeks of age. And then they are dewormed every 2 weeks until they've had multiple treatments. And again, these deworming protocols vary clinic to clinic and region to region, but it often is given every 2 weeks to puppies pretty young. Okay, so before we go on to cestodes, I want to just practice what we learned. So number one, what are the common life stages of most nematodes? So in your mind, you should be thinking, oh, right, eggs that embryonate and maybe 4 larval stages with L3 being infective and sexually mature adults. That's kind of a typical cycle for them. What is the most common method to diagnose nematodes? All right, did you think to yourself, fecal float? So most nematode eggs float. Again, this is a generality and it doesn't apply to every single nematode, but in general, nematode eggs float. We're going to find them on fecal float. What's the general appearance of a nematode? You're right, these are cylindrical spaghetti worms. What's the zoonotic condition that can result from Toxocara canis? Did you think to yourself, visceral larval migrans or ocular larval migrans? Because if you did, you got it right. Good job. What's the zoonotic condition that results from the ancylostoma? Okay, hopefully you thought cutaneous larval migrans and you remembered that picture of a foot with a creepy crawly worm under the skin. What's the difference in the appearance of a large and small strongyle egg? That's right, no difference. We cannot tell them apart based on their eggs. They look the same. And what is the Barber's pole worm? Yep, Homuncus contortus, which is the one that also causes a bottle jaw in sheep. And then what's the parasite that causes summer sores in horses? All right, hopefully you said Habronema or Droscia. Those are the stomach worms of horses that are transmitted by flies and cause summer sores on the skin of horses. Good job. It's always good to chunk material and try and review key points. Hopefully you've been making your flashcards and you'll be able to memorize all of this information. I know it's a lot, but you got it. Hang in there. All right, our next group of parasites are the cestodes. Cestodes are called flatworms or tapeworms, and they lack a body cavity, and I think of these as rice because when those little proglottids break off and dry up, they look like a little piece of rice stuck to a dog or cat's hind end. The life cycle of tapeworms is always indirect, so that means that it requires either one or two intermediate hosts, and the intermediate host can be a variety of different critters. So we could have an arthropod, a fish, a mammal, and the domestic animal themselves can be either the definitive or intermediate hosts. Our first cestode is Dipylidium caninum. This is the tapeworm of dogs, and it affects dogs, cats, ferrets, and humans. Just a reminder, the body of a tapeworm is long and flattened, and it has three regions. There's a head, a snout, and then the body. And the body is composed of segments that are called proglottids. These proglottids are in different stages of maturity. So the ones near the neck are the most immature, and the ones most distal are gravid. So they're pregnant, full of eggs. And it's the gravid proglottids that break off and pass out of the body, and they are continually forming at the neck. When we see these proglottids, they look like rice in feces, as I just mentioned. An animal becomes infected with Dipylidium by eating a flea. The flea is the intermediate host, and the flea is carrying the infective stage within their body. The infective stage is a cysticercoid. We can diagnose this by seeing the proglottids, that is the diagnosis, or less commonly by finding egg packets on cellophane tape prep or fecal sedimentation. Remember, a whole packet of eggs is pretty heavy, so it's not going to float the same way that a nematode egg is going to float. Treatment is the medication praziquantel. Our next cestode is Taenia, and I put this on here because there's a whole bunch of different Taenia species that infect different animals, and I want you to associate Taenia with tapeworms. So if you see this type of parasite, Taenia, we are talking about a tapeworm. So we have one Taenia hydatidgenia, which infects dogs when they eat raw venison. We have Taenia teniformis, which infects cats when they eat rats and mice. We have Taenia ovis, which will infect dogs that eat dead sheep, and Taenia multiceps, which infects dogs that eat the brains of sheep that carry the parasite. So, there's a lot of different types of tapeworms. A lot of them are from eating raw meat. So if you see Taenia, think tapeworm. I also want you to think tapeworm if you see Echinococcus. So Echinococcus granulosus and multilocularis are significant because they're zoonotic to people. And when people get infected, they get hydatid cyst disease, which is cysts that form in the liver and lungs most commonly. They could affect other organs as well. So this ultrasound has a picture of the liver that has hydatid cyst disease in it. So there's lots of cystic structures from an infection with this tapeworm. In general, the Echinococcus granulosus infects dogs, and the Echinococcus multilocularis infects cats. When we want to treat our cestodes, we're going to grab an anti-cestode medication such as praziquantel. This commonly goes by the name or brand of Dronsit. Praziquantel causes disintegration of the worm's outer tissue layer, so the worm kind of disintegrates or falls apart. It's effective against juveniles and adults, but not the eggs. So when we are prescribing it for a patient, the instructions are usually to give it now and then repeat it again in 3 weeks once those eggs have had a chance to mature. And nowadays we're seeing praziquantel included in a lot of different combo products. So it's in Drontal Plus, it's in Interceptor Plus, and all the time there's new products coming on the market that include multiple dewormers. And so you're going to see praziquantel on the label, and you're going to know that's used to treat tapeworms. Another anticestode medication is epsiprontal. This is Cestex, and it is used to treat Taenia and Dipylidium, but not the Echinococcus species. And the other thing to note is that when we're deworming for tapeworms, we want to also recommend flea control, and that's because the flea is the intermediate host for the Dipylidium, and so if we're not treating the fleas, the animal's going to become reinfected. Our next phylum of parasites are the trematodes. Trematodes are unsegmented and they're leaf-like, so they're broad and flat. The trematode life cycle is complicated. They have several larval stages and they typically require one or more intermediate host, but one of their intermediate hosts is almost always a mollusk, which is like a snail or a slug. The first trematode that we're going to talk about is Fasciola hepatica. This is the liver fluke of ruminants, and as I mentioned, it affects ruminants. It can also affect camelids and humans, and so it has a snail as the intermediate host, which is what is common for a trematode. When a cow or a sheep or a goat becomes infected, they often have liver damage, so they might appear icteric, have a poor appetite, lethargic, weight loss. The diagnosis is via sedimentation. These flukes and their larvae are pretty big, and so they're not going to float. We're going to find them at the bottom of the tube after centrifugation in a sedimentation procedure. Treatment is chlorsulon or albendazole. The next trematode that I have here for you is the Paragonymous kellicoti, also known as the lung fluke, that affects carnivores. So we could see this in dogs and cats. And the life cycle for this fluke has two intermediate hosts. One of them is a snail, which is what we expect for a trematode, to have a snail as an intermediate host. The other one is a crayfish. Some people say crawfish. Either way is okay. When animals are infected with this lung fluke, they have respiratory signs, which seems how I would feel if I had a fluke in my lungs. So coughing, dyspnea, and the diagnosis is a little atypical for a fluke. So we could potentially see the eggs in a fecal float, or we can do a transtracheal wash, which is rinsing the trachea or the bronchi with a little bit of, it's usually actually passing a red rubber past the trachea and then trying to collect a sample from lower in the lungs. So we're going to squirt a little bit of saline in there and then aspirate it back. And so it's possible to find eggs in that transtracheal wash as well. The third trematode that we're covering today is Nanophyetus salmon-cola, which is the fluke responsible for salmon poisoning fluke. We can see this when dogs eat raw salmon in the Pacific Northwest. It's the area that we can see this infection. And the symptoms are due to a rickettsial agent, which is inside the fluke, and that's what causes the symptoms of salmon poisoning. So we don't want dogs to eat raw salmon. They could get this fluke and then get the rickettsial infection and get pretty sick from it. Okay, antitrematode medications. The first one is called chlorsulon, and this is in the family of the benzene sulfonamides. So it's a treatment for trematodes. I would specifically think of that one. I mentioned it for the Fasciola hepatica. We can also use our benzimidazoles. We've mentioned these before, so this includes L-bendazole and fenbendazole. And interesting enough, our praziquantel has some anti-trematode effects. So I talked about using praziquantel as Dronsit for a lot of our cestodes, but it also can be used to treat some trematodes. The next phylum of parasites are the protozoa. protozoa are single-celled organisms, and they have one or more membrane-bound nuclei. The most common sites to detect them are in blood or feces. So we have blood protozoa that we're going to call hemoprotozoa. And then we also have fecal protozoa. Those we're just going to call intestinal protozoa. I'm going to cover both of those. Most hemoprotozoa that are seen in the United States are found within the erythrocytes. Remember, that's in a red blood cell. And we can often see them on a stained blood smear. For those hemoprotozoa, the tick is usually the intermediate host and can transmit the red blood cells that contain the hemoprotozoa from one animal to the next when they're feeding. There's a word trophozoite that we're going to mention, especially when I talk about Giardia, and that refers to the motile feeding stage of a protozoal parasite, and it's often the diagnostic phase. So motile means it's able to move when it's in that trophozoite phase. Our first protozoa is Giardia. Giardia is a flagellated protozoan. It can be found in the feces of dogs and cats that are having diarrhea, but also recovered from animals that have normal stools. The parasite occurs in two forms, the trophozoite stage and the cyst stage. We're going to see the cyst on a fecal float, whereas the mobile trophozoites are usually just seen on a direct smear. There are some really great ELISA tests out there. ELISA tests are the technology in like a SNAP test if you're using those in your practice. When an animal's infected with Giardia, they have GI signs, so vomiting, diarrhea, lethargy, poor appetite. It is zoonotic, although it looks more and more that there are species of Giardia, and some of them are more likely to infect humans than others. So it's still always good to make sure clients are using good hygiene when their pet has Giardia, so washing their hands, cleaning up the yard frequently. Treatment is a combination or on their own. We can use metronidazole and or fenbendazole. Those are the drugs used to treat Giardia. And then environmental control is important. So some animals get reinfected from their own backyard. If they poop on the grass and then go out and chew that grass, they can get recontaminated with Giardia. Our next protozoa is the Tritrichomonas foetus. This is a reproductive parasite of cattle, so it can be spread during breeding. And when they're infected, the female cow can become infertile. She can spontaneously abort the fetus or develop a pyometra. And, if you're in the livestock business, losing a calf is significant economic loss. So it's really hard if we're losing those calves. That can impact our ability to run the business. Interestingly, we can also see Tritrichomonas foetus in cats as a diarrheal disease. Our next protozoa are the coccidia. So coccidia can be broken down into subtypes, and the Isospora is the old name that we use to describe the coccidia for dog, cat, and pigs. And it has been recently renamed Cystoisospora because sometimes they're finding it in tissues. I think for the VTNE, it's likely to still have Isospora on there, but I just want you to be aware that there's two names for the dog and cat coccidia. The rabbit, ruminant, and equine coccidia is called Eimeria. When animals are infected with coccidia, they tend to have GI signs, so diarrhea, weight loss, dehydration, and it's much more common in puppies and kittens or young animals. As they get older, they get a bit more resistant to coccidia infections. Diagnosis is to see the oocyst on a fecal float. Treatment is with sulfadimethoxine, which goes by the brand name of Albon. And then I have a picture here. You can see the eggs of Isospora. To me, they kind of look like a hard-boiled egg that has the yolk dividing. So the yolk could be singular, or the nuclei, or it could be dividing depending on what stage it's in. Our next protozoa is the Toxoplasma gondii, and this one you should remember that the cat is the definitive host, and what that means is it can only complete its life cycle if it goes through a cat. So otherwise, another Animal can get infected with Toxoplasma gondii, but not the Toxoplasma gondii doesn't complete its life cycle. It doesn't shed the oocyst again. Diagnosis is usually on a fecal smear, and transmission is going to be from eating undercooked meat or eating contaminated fruits and vegetables. This is the disease we don't want pregnant women to scoop the litter box in case they accidentally eat some of the cat feces, because it can really cause defects in a developing embryo, a human embryo. Our next protozoa is Cryptosporidium. This is a coccidian parasite that affects a variety of animals, but particularly calves. And it's really tiny. So the sporulated oocysts are only 4 micrometers to 6 micrometers, which is too small to see on our basic microscopes. You need kind of a fancy microscope to see them. They're so small. But diagnosis is still to see them on fecal float and then add some stains. And Cryptosporidium is zoonotic and can cause really bad diarrhea in people. So diarrhea in calves and diarrhea in people. Our next protozoa is Sarcocystis neurona. This is an intracellular protozoa that causes the equine protozoal myeloencephalitis. And that disease in horses is sometimes abbreviated as EPM. And this parasite includes a possum as well as other intermediate hosts in its life cycle. All right, we are now on to the hemoprotozoa. Babesia canis is a parasite that affects red blood cells, and it appears as a pyroplasm, which is a fancy way of saying like a little teardrop. This Babesia is spread by ticks, and when animals are infected, they can have a fever, they can be weak, have pale mucous membranes, swollen lymph nodes, enlarged spleen. Diagnosis is going to be seeing the little inclusions, the little pyroplasm inclusions on a blood smear. And I will note that they could be singular, paired, or even in groups of 3 or 4, in like little pyroplasms within a red blood cell. So the number of inclusions can vary. We could also do an ELISA, and there are PCR tests to diagnose Babesia. If we have a positive patient, we're going to treat them with imidacarb or clindamycin. Our next hemoprotozoa is Cytoxoan felis. And this is an intracellular parasite that affects the red blood cells of cats. On a blood smear, we can see a bejeweled ring. So it's like an engagement ring. You can imagine the inclusion here as a bejeweled ring inside a red blood cell. This is pretty bad for cats. They can decline and die pretty quickly if they're infected with it. Fortunately, it's not very common. Rickettsia parasites are considered hemoprotozoa, and these are a group of obligate intracellular gram-negative bacteria. So this is a whole group of infections, and I'm going to list them and then talk about them individually. So we have Rickettsia rickettsii, which is the infection responsible for Rocky Mountain spotted fever. Anaplasma, and there's a lot of different types of anaplasma. Ehrlichia, again, there's multiple types of Ehrlichia. And then Neorickettsia, which is the infection that causes Potomac horse fever and also the salmon poisoning. This is the rickettsial infection that you could find in the Nanophylaetis salmonicola fluke that I mentioned a few slides back. All right, anaplasma. There's different subspecies of anaplasma, and so it affects ruminants, but other species as well, so it can affect horses and dogs. It is a tick-borne infection, and when cows are infected, they will have decreased milk production, ataxia, exercise intolerance, bounding pulses, fever, pale or icteric mucous membranes, and they can have abortions. So again, this could really impact the economic production of a dairy or of a beef ranch if their cows are sick and not making milk or not reproducing. And so it is a big deal to the livestock industry. Diagnosis is going to be using a Giemsa stained blood smear. We could also use ELISA or other serology to diagnose anaplasma. Treatment is going to be tetracycline antibiotics or imidacarb. And there is a vaccination to prevent disease. And I just want to mention that a lot of our rickettsial diseases or even tick-borne diseases are treated with doxycycline, which is a type of tetracycline. So if you have a tick-borne disease and you don't remember exactly what drug is used to treat it, it's a good guess to just go with doxycycline for tick-borne infections. Our next hemoprotozoa is Mycoplasma haemophilus. So years ago, this was called feline infectious anemia or hemobartonellosis or hemobartonella. And this parasite is transmitted by fleas and it affects cats. When they are infected, they can become anemic, jaundiced, have a fever, develop splenomegaly or lymphadenopathy. Diagnosis is going to be on a blood smear. We're looking for the little inclusions on the margin of the red blood cells, so they tend to be around the wall, or PCR. And then treatment, again, we're going to use potentially doxycycline, enterofloxacin, or marbofloxacin, our treatment options for Mycoplasma haemophilus. And this one is seen periodically, so we do. When I was in practice, I would see cases that had this. Antiprotozoal medications. So the first group are coccidiostats. So these are used to treat our coccidia parasites. The first one is sulfadimethoxine, which goes by the name of Albon. I have a picture of that. Amprolium goes by the name of Corid. Decoquinate. And monensin. Monensin is cardiotoxic to horses, so it could be used in ruminants, but not in horses. When we were talking about Giardia, I mentioned using metronidazole, which goes by the brand name Flagyl. So that could be used for some coccidia or some protozoa, specifically Giardia. We can also use our benzimidazoles. So this is fembendazole. I've talked about that with other classes of drugs. So that could be used to treat some nematodes and some trematodes and protozoa. So it's pretty broad spectrum. And then there are some triazines that are also effective at treating protozoa. So there's a drug called Pinazaril, which is a marquee paste for horses. And diclazaril is another drug that can be used for protozoa. The last parasites we're going to cover are the ectoparasites. Ecto means on the outside, so these affect the outside of our patients. And these are typically either insects, so that's fleas, lice, and flies, or arachnids, and our arachnids are the ticks and mites. Just a reminder about the difference. Insects have 3 pairs of legs and 3 distinct body regions, so a head, thorax, and abdomen. Whereas arachnids have 4 pairs of legs, and then their body is divided into 2 regions. They have a cephalothorax and an abdomen. So ticks and mites are considered arachnids. Fleas and lice are insects. Our first ectoparasite is the Tenocephalides felis or Tenocephalides canis, commonly known as a flea. Fleas are blood-sucking parasites. They can land on different animals, so dogs, cats, rodents, birds, and people. And they're vectors for several diseases, which include bubonic plague and tularemia. The adult fleas are always parasitic, so they feed on mammals and birds. Tenocephalides felis and canis can act as the intermediate host for the common tapeworm, Dipylidium caninum. Heavy infestations with fleas in young animals can produce anemia. It's like the fleas take such a large percentage of their blood that they become anemic. And then the flea saliva is antigenic, which is like stimulating the immune system. So their saliva is antigenic and irritating, and so it can cause an intense pruritus and hypersensitivity in animals that are allergic to it. And this condition is known as flea bite dermatitis or miliary dermatitis or flea allergy dermatitis. We diagnose fleas by visual observation. So if we see the flea, then we have a diagnosis. We also can make a diagnosis if we find the flea dirt, which is flea feces left behind on the animal. Treatment includes either a topical or oral product on the pet and also treating the environment. And we'll cover some of the flea treatments at the end of the ectoparasites. Next, we have malophagia and anopleura, which are both lice. So if we have a louse infection, it's called pediculosis. And it's going to be more common in poorly nourished animals. There's two families of lice. The malophagia are the biting or chewing louse, and they really just cause irritation. So they're kind of itchy and irritating to the animal, which is different than from the anopleura, which are the sucking louse, and these feed on blood and cause anemia. Lice are species specific, so kind of like the pinworm. If a child has lice, they have gotten it from another child. They didn't get it from their pet. And the eggs are called nits. The pictures there, you can recognize the difference between a malophagia and an anopleura. So the malophagia have a big broad head, and the anopleura have a small pointy head. Botflies are bee-like flies, and the adults will glue their eggs to the hair of the host. The eggs hatch and penetrate into the skin as larvae. Some of these larvae migrate extensively throughout the host's body, while others will just sort of stay and develop locally. The larval stage is called a bot, and it can be present in the nasal passages of sheep, which is the oestrus ovis. In the stomach of the horse, it's called gastrophilus, and the bot in the subcu of the cow is called hypoderma. Cuterebra are parasites of rabbits and rodents, and they can also infect cats, dogs, and humans. Cuterebra are also called warbles, and they produce large pockets in the subcu tissues as well as an air hole in the skin. Now, I'm unable to show the video that I have in the PowerPoint. It won't work through this recording medium, but if you have a chance, look for a video of a veterinarian removing a Cuterebra. It's quite fun. Ticks are another type of ectoparasite, and remember they're arachnids with 4 pairs of legs. There's hard ticks and soft ticks, and most of the ones we talk about are hard ticks. And there are tons of ticks out there. I've picked 3 to review today. If this is an area that you are interested in, please continue your self-study. First up, we have Dermacentor variables, which is the American dog tick that can transmit Rocky Mountain spotted fever. Second, we have Ixodes pacificus, the black-legged tick that can transmit Lyme disease. And then third, we have Rhipicephalus sanguinis, which is the brown dog tick that can transmit Ehrlichia and Babesia. So I think it's a good idea to associate the tick with the infectious disease that it is known to transmit. Demodex is frequently called mange, although mange could also be used to describe scabies, so it's not unique to Demodex. Demodex is a follicular or burrowing mite, and so what that means is that the mite is not just on the surface of the skin, it's down in the hair follicles. We can't see it because it's inside the hair follicles out of view. 95% of Demodex cases are localized, and the patients just have a little patch of alopecia here and there. But about 5% of the cases are generalized and have alopecia widespread around their body with secondary infections and erythema. The face and feet tend to be most severe, and the animals that get the generalized Demodex tend to be immune deficient, and so their immune system lets the Demodex run wild. We diagnose Demodex through a skin scrape, and that should make sense because the mite is deep in the follicle. It's not just on the surface of the skin. In general, Demodex is not super contagious, so we don't worry about it too much spreading between animals or from an animal to a person. If we have someone who's immune compromised, it could potentially infect them, but mostly it's not that contagious. Treatment is going to be oral ivermectin, mitaban dips, And then more recently, we use an isoxazoline drug off-label. And the isoxazolines are NexGard, Credelio, Bravecto, Simparica. Those drugs have great effects against mites. And so we're seeing far fewer mites these days than we used to. The next mite is Sarcoptic scabii, which is scabies, again, also called mange. And this is also a follicular or burrowing mite. So it's deep in the hair follicle. It's not on the surface of the skin. This is a zoonotic mite. And so we could get this one from our patients if we are not, if we are touching the area that they're infected without wearing gloves or PPE. Scabies causes intense pruritus and alopecia. So animals infected with scabies are pretty miserable. They're scratching constantly. Diagnosis is skin scrape. Again, the mite is deep in the follicles. We have to scrape until we get a little capillary bleeding to hopefully get deep enough and find them. The adults are oval shaped. They have 4 pairs of legs. And as I mentioned, they're zoonotic. They do get transmitted pretty easily between people or between animals. And then the treatment is usually selamectin, which is Revolution, topically, and the frequency is increased from the labeled dose. So instead of just giving it once a month, we give it every 2 weeks for 3 treatments. Chiletiella is a mite that is on the surface. This is called walking dandruff. And so we can see this mite as it creeps and crawls because it's a superficial or non-burrowing mite. It's found on dogs and cats. It also causes intense itching, and it's also zoonotic. Diagnosis is just by combing some of the dandruff onto a black piece of paper and seeing it walk. We could also look at it under the microscope. So we could use a cellophane tape prep and tape the mite to a slide and look at it under the microscope. What we will see is that the mites are bell-peppered shape with a pair of accessory hooks on their head and combs at the end of their legs. So look at the body of this Chiletiella. It's bell-peppered shape, which is different from the mite on the previous slide. The scabies was more round. We're going to treat Chiletiella with ivermectin, selamectin, moxidectin, or pyrethrins. The 2 ear mites are also superficial mites, so they're not burrowing into the follicles, but they are just creeping around the ears. We have a picture of Otodectes here. So Otodectes cynotus is the ear mite of dogs and cats. And then Sauroptes caniculi is the ear mite of a rabbit. And these mites, to me, they look really like Superman. Their legs really go forward instead of out to the sides, and their legs are a little bit longer. So it's kind of like they're going for a dive in the ear canal. Also on this slide, you can see some eggs. So those are mite eggs on there as well. When it comes to medications for ectoparasites, there's different classes of medications used. And first up is the pyrethrins or pyrethroids. These can be toxic in cats, so we don't want to use this type of med for a cat. And you can find pyrethrins in like the flea sprays and dips and spot-ons from the pet store. There's drugs that are insect growth regulators that will just kill the larval stage of a ectoparasite. So we have methoprene and pyriproxyfen. Methoprene is involved. It's one of the ingredients in Frontline. So it's combined with the fipronil, which is over on the right side. Let's start at the top on the right. We have the chitin synthesis inhibitor. This is lufenuron, and it just prevents the eggs from developing, but it won't kill adult fleas. So it just sort of halts or stops development. Not the best flea control, but it does prevent a lot of adult worms or adult fleas from hatching or developing. Phenylpyrazole is the fipronil, which is in Frontline, and one thing clients like is that it's not really absorbed in the blood. It stays topical and has its effects topically. Neonicotinoids, we have Capstar, nitinpyran, and Capstar is great for quick, I need to get rid of all of these fleas, but it's not great for, I want to prevent fleas on my dogs all month. When we give Capstar, the adult fleas are usually killed within 30 minutes, but then by the end of the day, the drug is out of their system and the fleas can all come back again. I like using it if I have a patient that has fleas. I like to give it to that, and they're going to have surgery. I like to give it before surgery, and then by the time they're on the table, the fleas are gone. Isoxazolines have really taken over the market for our flea and tick prevention. This class includes Bravecto, NexGard, Simparica, and Credelio. Most of these drugs names end in Laner, Laner, so that's a way to recognize them. And they treat other ectoparasites. Some of them have labels for various ticks, potentially mites, but they are effective against more ectoparasites than are on the label. And then last we have imidacloprid, which is in Advantage, the topical flea preventative that is effective in some cases and typically well tolerated. But I love you, baby. Fleas, Samuel. You gave me fleas. Happy studying. Hey, you're going to do great on the VTNE. Don't forget to make your flashcards, and good luck.